Hello, my name is Henry, and today I will present my population health program implementation. This program focuses on reducing cardiovascular disease risk among Asian adults aged 20 and older living in Colorado. I selected this program because honestly I couldn't find the data for older adult. However, I believe by including adults 20 plus, the program can address prevention earlier in adulthood, and it can help them to build lifelong cardiovascular health habit. This population represents one of the fastest growing groups in Colorado, about 44% increase in its Asian population between 2010 and 2020, compared to overstate growth 14%. I think that's pretty fast. And Asian adults face unit cardiometabolic risks that often go under-recognized, including elevated risk for hypertension, hyperlipidemia, and underutilization of preventive care. And although Asian adults are sometimes assumed to have low cardiovascular disease risk, the data shows significant disparity within this population, such as the data I got from America Health Rankings, with Asian, they have 18.6% of deaths caused by heart disease in 2021, just right behind Black non-Hispanic, 22.6%. Also, I found some data showing hypertension among Asian adults has increased steadily in the last decade. For example, the data from Colorado Department of Public Health and Environment, approximately about 20% of Asian adults in Colorado report being told they have hypertension in 2023 compared to 2021, which is 17%, 3% increase in 2 years. And additionally, Asian adults are less likely to engage in routine prevention care, which are 7% less likely to have a recent preventive care visit compared to white adults. So based on this disparities, the health improvement goal for this program is to increase blood pressure control among Asian adults in Colorado by at least 10% within 12 months or a year. The Million Heart Initiative provide a really great and helpful framework for designing this program. So we will focus on improving the ABCS of cardiovascular health, which is aspirin use when appropriate, blood pressure control, cholesterol management, and smoke cessation. It also strongly supports self-measured blood pressure monitoring, team-based care, and partnership between clinical providers and community organization. I believe all of those are really essential for engaging Asian adults who are not routinely visit traditional healthcare setting, and we will dig deeper about those in the next pages. So for the first strategy is to implement community-based blood pressure screening, but also pair with self-measured blood pressure monitor. In Colorado, many Asian adults congregate at community center, temple, ethnic grocery stores, and cultural association. So those pay gonna be a great place because they are trusted and accessible, making them ideal for preventive health engagement. So we're gonna go to this site, and we can offer multilingual blood pressure screening, and we can distribute validated blood pressure monitors to people who screen high and who have risk factor for hypertension. We will use million hertz SMPP training material as well to ensure people learn how to measure blood pressure correctly and record it correctly at home. This strategy will have overcome barriers such as limited trust in healthcare system, lack of transportation, or time consuming because they already there as the place they would like to go, and we just there educate them. It's also identify undiagnosed hypertension, which is really important in Asian adult because hypertension is often asymptomatic and, like it's a silent killer. For strategy, the second strategy is the nurse-led hypertension care. This will have the liver through. This will be delivered through Colorado federally qualified health center that already serve diverse Asian population. We will do monthly visit, which will focus on blood pressure monitor and goal setting, medication review and support, diet counseling that acknowledges cultural food references, cholesterol management and referrals if they need, smoking cessation for people with high tobacco use as well. And the nurse-led counseling will tailor education to these differences from culture to culture. This strategy will be strongly supported by the Million Heart Hypertension Control Change package, which has been proven to reduce blood pressure, improve adherence, and increase continuity of care. The third strategy is a cultural tailor multilingual lifestyle health program. So we will offer in-person or even virtual group classes, offer English, Mandarin, Korean, Vietnamese, Hindi, and more. And the topic will include DASH diet principles, sodium reduction strategy in traditional cooking, physical activity recommendation, smoke cessation support, also stress management, which will be including culturally relevant approaches. And I believe group program will help people feel supported, increase motivation, and reduce cultural stigma around discussing about chronic disease. And for sure, we're using the Million Hearts lifestyle resources. For the scale holders, we will have Asian Pacific Development Center, which will provide cultural navigation, translation services, and access to justice community spaces. I believe the involvement will ensure intervention remain cultural grounded and multi-languages accessible. Also federal qualified health center, Stride Community Health, and Denver Health are the big community health center here in Colorado. So they will provide a clinical backbone for monthly nurse-led hypertension management, and they will have the capacity to track ABCS metrics and coordinate referrals for cholesterol management. And the last one is Colorado Department of Public Health and Environment. They will support the program by providing state level data, access to smoking cessation program, and guidance on public health messaging that resonate with Asian community. And for sure, we will use cultural tailor, evidence-based, and system support to evaluate this plan. We will use two measurable outcomes: an increase in percentage of participants achieving controlled blood pressure, defined as less than SPP less than 130, and an increase in engagement with preventive services, including like annual blood pressure and cholesterol screening documented in the EHR. We will track SMPP logs monthly and review clinical data quarterly. Stakeholders will meet every 3 months to see if we need to adjust anything, or like identify needs or gaps. And at the end of 12 months, we will compare baseline and post-intervention data to evaluate whether we achieve our 10% improvement goal. And in conclusion, I believe the Million Hearts Initiative provide a really adaptable framework for preventing cardiovascular disease as the population level, especially in communities that experience unique or underestimated risk. So by integrating data, cultural tailor, and community clinical linkage, this program, I believe, will have a potential to significantly improve blood pressure control and reduce disparities among Asian adults in Colorado. And this project also demonstrate population health leadership and align with RN competency, and for sure we're using evidence-based strategy with cultural insight, so we can advance equity, improve outcome, and build a healthier future for diverse community. Thank you for listening, and this is my references. Thank you.